The Hypervolt is a great tool for massage therapists. It's an adjunct tool, not to replace your hands, but it's actually a phenomenal tool because you get the benefits of vibration therapy. And vibration therapy creates neuromuscular inhibition by stimulating the Golgi tendon organ, which inhibits muscle spindle and therefore allows the tissue to become more pliable. And sometimes people call that soft tissue hygiene. And so it's a really good technique for you to do. And there's multiple attachments. I currently have the finger attachment on, which could be like you pressing. And again, this could be done for neuro inhibition, or it can also be done for lengthening techniques. So I'm just gonna demonstrate here on Rachel. So if I were working on Rachel's IT band through this area, I could go through and find areas of adhesion, areas of restriction. And when I find those, I would hold that for 30 seconds and get that to relax. And the reason I'm holding it for 30 seconds is that's about how long it takes to stimulate the Golgi tendon enough to inhibit the muscle spindle. And I can also add some lengthening into that tissue as well. So just like using your fingers, so this is a good way for you to save your fingers, but it's also a good way to add in vibration therapy as an adjunct to your already expansive box of techniques. There's multiple heads that you can use in the Hypervolt. I was previously using the finger projection. That's great for saving your fingers. I like using the rubber tip projection. That's great for every part of the body, and it's nice and soft, especially for a beginning client. And then we have the flat head, which can typically be used for bigger surface areas like hamstring, gastroc, gluteus maximus area. And then the finger projection, this tool can be used in some of your tendinous areas. So I'll give an example down here around the Achilles. So again, stay off of the calcaneus, stay off of the medial and lateral malleolus, and you can use this just right along the Achilles to be able to get that tissue all the way up to the gastroc, and it's just a good area that you can use that for. So the Hypervolt has multiple attachments. This is the round-headed attachment. This can be used on virtually every part of the body. I like using this with first-time clients just so they can get used to vibration therapy. We have the finger projection tool, which I like to use around areas that have a lot of myofascial adhesions. This helps to save your fingers, but it adds the vibration therapy component to it. And then we have the flat-headed version. This is great for large surface areas, and it goes very smooth. And then this particular projection can be used around like the Achilles tendon. You can also use it around the thoracic and lumbar spine, but you just have to obviously be very careful as you're doing it and knowing exactly the positioning. So another very good attachment.